Blood pressure assessment by Robert Vasquez. First things first, patients should be seated quietly for at least 5 minutes in a chair with back support, with their feet on the floor and their arms supported at heart level. Patients should refrain from smoking cigarettes or ingesting caffeine at least 30 minutes preceding the measurements. Beginning, make sure that the earpieces are facing outward, as it will give incorrect readings. You can test the stethoscope to make sure sound works. Make sure all your equipment is in place. Once again, check patient is sitting supine and the standing values may be indicated under special circumstance. Make sure the arms and the palms are facing upward and the feet are planted firmly on the ground. We may begin by finding the appropriate cuff size. Most adults will use a large cuff, as this one. Find the antecubital space on the brachial artery. Check for pulse and place the cuff firmly around the upper arm at heart level. Align the cuff with the brachial artery. Remember, the appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Many adults require a large adult cuff once again. Place the gauge firmly onto the cuff. That way you can read the results and the readings. Adjust cuff if it falls down. Now, place stethoscope chest piece below the antecubital space over the brachial artery. Bell and diaphragm side of the chest piece appear equally effective in assessing blood pressure. Make sure all air pressure is released from the cuff before inflating. Now quickly inflate cuff pressure to 20 millimeters Hg above first cuff sound. Once you hear, slowly release pressure at a rate equal to 2 to 5 millimeters per Hg. Keep in mind, systolic blood pressure is the point at which the first of 2 or more cough sounds is heard, and diastolic is the point before the disappearance of the cough sounds. Now at least 2 measurements should be made, minimum of 1 minute apart, and the average should be taken. Blood pressure should be measured in both arms during the first examination. Higher pressure should be used when there is a consistent inter-arm difference. Provide to patients verbally and in writing specific blood pressure and blood pressure goals. Make sure to give the patient the goal categories you are searching for. We are looking for normal or prehypertensive patients before they get worse. This is the group number values. As you can see, I was normal to prehypertensive, and our references are available.